Hey YouTube, this is Robert from Merit Web Project, returning again, and I have James Thompson loaded, one of our fictitious clients that we use, and this video is going to be how to use advanced techniques with problem identification and a couple other things, including treatment plans. I just can't stress enough how important it is when you counsel somebody to identify a problem. Without a problem identified, you have no need to counsel them. If the person doesn't have a problem, then you should not be seeing them. If you are seeing them, you are not seeing them in a therapeutic way because there is no problem. That's how the courts will see it. So it is imperative every time you take on a new client that you analyze their case to determine what their problems are. When a person comes into an emergency room and they say they have pain in their head, they don't just look at them and say, oh, let's give them Tylenol. The person may be having a stroke. They may be having a seizure. Who knows what might be happening? It might be an aneurysm. Tylenol? I don't know. It might kill the pain. Might kill the patient. Those would all be indicators that a problem had not been identified. We can't do that in counseling either. When a person comes to us, a lot of times they don't know what's really bothering them. As you begin to counsel, as you begin to talk to them, it will begin to become very clear what they're there for, what the problem is, and you need to take the time in the beginning of this relationship to locate a problem. First of all, to get to know the client well enough so that you can create an ASAM narrative. Sometimes counselors just want to look at the psychological issues. Okay, this person's depressed, they've got anxiety, they got whatever. What else might be involved here? What else might be causing them to come to you? Get the whole picture. You have to get the whole picture. When the person comes into the emergency room, says they have a headache, they take their temperature. That usually doesn't have anything to do with a headache. Why? They want the whole picture. They want all the facts. Get all the facts. It is so important. And what you're going to find when you begin to do this on a very regular basis, you're going to find that the counseling process will become much more straightforward. And it will actually probably be easier than it has been in the past. And in fact, it will become much more effective. You will get to the place of healing. And that's where we want to go. So I just talked about the ASAM. Something else that I need to say that's very, very, very important. And I've seen people do this in clinical practice. I don't understand it. But you cannot create a problem and then not attach a treatment plan to that problem. There is no need to identify a problem if you're not going to treat that problem. The treatment plan and the objectives defined in that treatment plan are in fact coupled together in such a way that when you create a problem identification for the person, you may have 3 or 4 of them, it is only natural to immediately create a treatment plan. I got a problem. How am I going to treat that problem? What are my step-by-step objectives to help this person reach the objective, the ultimate goal for them coming into counseling? This is truly the healing effort that needs to be done. Now, I don't know how long I'm going to be able to go here. Before we cut this off, I was hoping to keep this all into one video. Where I usually start is with the DSM to see if I can diagnose a person officially. When you create a problem, the more nebulous the problem is, the harder it's going to be to create true objectives in a treatment plan to heal that problem. You need the problem to be generic enough, but mainstream enough to be able to be identified logically and to put objectives for that problem. You're going to find most likely that you don't see, wow, it would shock me if you have 10 problems that come into your counseling office. It would shock me. I'd like to see what they are. Now, yeah, you may see it. You may be a very broad counselor. You may see 10 different things. Depression, anxiety, panic disorder, and so on down the list. Impulse control disorder, addictions, stuff like that. You may see 10. I'll bet you that most of your counseling is going to fall in 5 or 6 problem definitions. You can can those. You can store those. And when you store those, you can use them again. First thing I do is I try to diagnose a person using the DSM. If I can't, I try to come up with a generic enough problem identification so that I can use it over again. So many things are so common. You're very rarely going to find a person who has a problem that is so absolutely unique that it can't be shared with other people. I've got James open here, and here's what I'm going to do. I'm going to go to Axis 1, to anxiety disorders. I hit that again. There's only one category under there. I'm going to go down here. This is a DSM-4 diagnosis. 300.23, social phobia. It's been changed under DSM-5. It's now social anxiety disorder. I don't like much about the DSM-5. I like the redefinition and the new diagnostic criteria for 300.23. I really do like it. Roughly the same thing. I'm going to tag the client with this. I'm just going to close out of this, and I'm going to go refresh this screen. So I just diagnosed my client here, James, with social phobia. DSM-5, it'll be social anxiety disorder. And the reason I did that, he's got a bunch of symptoms, and I knew it was a social issue. He's afraid of social issues. This is what you might have done. Social anxiety disorder, DSM-5. Okay? You get a bunch of definitions. Well, I like this one from socialanxietyinstitute.org. And here you see the DSM-5 actual diagnostic criteria. That's what I was looking for. So what I did is I copied this. And I put it over in my Word doc. Over here, you see, this is the same stuff. Most of it, and some of it I cut out because I've been doing this a while and I know what I can cut out. And I grabbed the key phrases out of here. Ended up with this. Now, remember before, we talked about the fact that this should be really structured in the same way every time. You get before a judge, and the judge says, what was this client's problem? You can honestly say the client was experiencing social phobia or social anxiety disorder, if you wanted to put it that way. And the judge will say, what's that mean? I don't know what that means. Social phobia is characterized by persistent fear of one or more social or performance situations, and so on and so on and so on. This stuff down here is kind of an amalgamation of this stuff up here. Boom, that's gone. Don't need that anymore. What we're going to do is we're going to go down here and we're going to put him together. That is the client's problem. And notice I don't have James is experiencing social phobia. The reason is because we're going to can this. We're going to store this. You don't want to put James there because next time you pull it in, it's going to say James and it might be Sue. So don't put anything more than generic information in here. A real diagnosis if you can. If not, we'll see what we do about that when we get over on the other side. And so you see I've pulled that in. My objectives, we've got this other thing open, social anxiety disorder, cognitive behavioral treatment. I like to use CBT if I can. And in this particular case, I was able to find some really good stuff. Let's see, we'll go here first. You read through this stuff from socialanxietyinstitute.org. Some really good stuff here, but it's hard to extract. It's hard to extract objectives. Then I found this thing. This is just tamu.edu. I don't know what that is. But there's this document, this PDF up there. And it's all about treating social anxiety disorder. And within the context here, I was able to extract some stuff out that I reformatted over here as the actual objectives to treatment, customized in my own way, but that's basically what that is. So you see what we've done here. We diagnosed the person as officially as we can possibly diagnose them. And then we went out and we looked for ways to treat that diagnosis. Moving right ahead here. Now, this is going to take you a little bit of time to do this with a client. But once you do this one time, you can use this over and over again. So let me see here. Where are we? Problem identification. Stored problems. Create a new problem. And remember, we want to go down here. Perform selected option. And we're going to call this social phobia. Problem definition is over here in our Word document. By the way, I use Libre 5 rather than Microsoft Word. No need to buy a product over and over and over again when you can get one free. Okay, that's just kind of off the top of my head. Now let's fix this. All right, apparently I can't spell that. Elevate. I didn't know that was correct. Okay, so that's the long-term goal, and we could have spent a little bit more time making that more official. And then back over to this again. We're going to put this objective in here. Down. Put this next objective in. And we'll let's scroll this down here. Okay. Number 3. You can see what we're doing. Now we're creating a canned product here that can be used over and over again. Anytime you have a social phobia, you can reuse this. We haven't put anybody's name in it. After you pull it over, you can put somebody's name in, but don't store it with somebody else's name in there. That makes it totally useless. All right, let's see here. Relapse prevention. And this is going to be the end of this line. We are now ready to store this new problem. It's been stored as social phobia. Now we're ready to go over to manage stored problems again. We're going to attach social phobia, the problem, to James. All we got to do is put in a date and optionally a name. Remember, we're not going to change any of this other stuff. We just saved his problem. Remember I told you, the problem, the treatment plan have to be attached to each other. Social phobia, unassigned. Start the treatment plan. We're not going to put any of that information in. I'm going to put me in here. 0426 2016. No other agencies involved in this. You can see we've got the problem description, long-term goal, the objectives. Oh, hit the cap lock. Individual counseling. I just researched a problem, a treatment plan, did a diagnosis, attached that problem to a person, stored it for future use, and completed the problem or the treatment plan with objectives, and that took us 15 minutes. So you can see that that treatment plan is now open, as well as impulse control disorder.